You know, our ears are pretty incredible, but let's be honest, they can also be the source of some really weird and, well, painful problems. From something as simple as a new piercing to a flight across the country, a lot can go sideways. So let's dive into this practical guide to really understand and handle some of the most common ear complications out there.
So, what on earth do piercings, planes, and, yep, even peas have in common? I know, it sounds like the setup for a really bad joke, but they're actually all tied to three of the most frequent ear issues people run into. So stick with me, because we're about to connect all those dots.
Okay, first up, let's talk about something super common, ear piercings. It might seem like no big deal, right? Just a quick pinch, but there's actually a little more to it. Understanding the risks is absolutely key to avoiding some serious trouble later on.
And believe me, the risks are real. This number might actually shock you. Up to 35% of people with ear piercings end up with some kind of complication. We're talking anything from a nasty infection to an allergic reaction. Seriously, think about that. That's more than 1 out of every 3 people.
So this is the really crucial part. Knowing the difference between what's normal healing and what's a big red flag. A little bit of redness, some mild swelling, maybe some crusting for 6 to 8 weeks? Totally normal. That's just your body doing its thing. But excessive swelling, real tenderness, any kind of discharge, or running a fever? Those are all warning signs screaming that you might have an infection.
The good news is preventing an infection is usually pretty straightforward. First things first, always wash your hands before you touch a new piercing. Then, just gently wash the area with plain old soap and water. That's it. Do that twice a day. And here's something you might not know. Alcohol is actually not recommended anymore because it can dry out your skin too much. But hey, if things do start to look bad, please don't wait around. An infection in a cartilage piercing, one higher up on the ear, is especially serious. That's because cartilage doesn't have its own blood supply, which makes it harder to heal. So if you see major swelling, any discharge, you start running a fever, or you think you might be allergic to the jewelry, it's definitely time to see a doctor.
Okay, let's move on. We're going from something we choose to put in our ear, a piercing, to something that's, well, an unwanted guest. A foreign object that gets stuck. And believe me, this happens way more often than you'd think, especially with little kids.
So how would you even know if there's a little trespasser in your ear canal? Well, the signs can be anything from pain and a weird feeling of pressure to not being able to hear as well, or even a foul-smelling discharge. Your body's basically sending up flares to tell you something is in there that really shouldn't be. Now, if you remember one thing from this whole section, make it this. And the source material could not be more clear on this point. Do not try to remove it yourself. Foreign objects should always be removed by a healthcare professional. End of story. Seriously, trying to be a hero here can make things so much worse. If you stick a cotton swab in there, you're probably just going to push the object in deeper. And trying to flush it out with water, that's a terrible idea, especially if it's something organic like that pea we mentioned, because the moisture can actually make it swell up. And of course, the worst thing you can do is just ignore it and hope it goes away. It won't. Okay, there is one very specific exception to the don't touch it rule. If that unwelcome guest is a bug, and I know, gross, and you're positive your eardrum is not perforated, you can use a dropper to fill the ear canal with some mineral oil or olive oil. This will drown the insect, which stops that horrible crawling sensation, before you head to the doctor to get it removed. All right, on to our third and final topic, that awful, painful pressure you sometimes feel in your ears when you're on a plane, or, if you're a diver, when you're underwater. This thing has a name. It's called barotrauma, and it's really all about a simple pressure imbalance. Otic barotrauma. It sounds like a fancy term, but it just means the pressure inside your middle ear doesn't match the air pressure outside your body. Think about a plane descending for landing, or when you're diving deeper into the water. Your eustachian tube, which is supposed to regulate that pressure, gets blocked. That pressure difference is what causes all that pain. So, how do you fix it? Well, you can actively help your ears equalize that pressure. There's the classic Valsalva maneuver, where you pinch your nose, close your mouth, and gently try to blow out. Or the Toynbee maneuver, where you swallow while holding your nose shut. And of course, the easiest methods, just a big yawn or chewing some gum often does the trick. But here's a really crucial warning. That Valsalva maneuver, the one where you blow against a pinched nose, it actually affects your heart rate and blood pressure. Because of that, it absolutely should be avoided by anyone with a history of cardiac disease. That is a vital safety warning to remember. And for all you scuba divers out there, listen up. The risk of these pressure problems is exactly why you can't just finish a dive and hop on a plane. The Divers Alert Network has some very clear guidelines. You need to wait at least 12 hours after a single, simple dive and 18 hours or even more if you did multiple dives or dives that required decompression stops.
So now that we've gone through all the problems, let's talk about solutions. Let's build your ear care toolkit, the proactive things you can do to stop these issues, especially barotrauma, before they even start. Research actually shows that a simple oral decongestant like pseudoephedrine can be really effective. If you're flying, you take it about 30 to 60 minutes before the plane starts to descend. For diving, about 30 minutes before you get in the water. But, and this is a big but, it's not for everyone. It is so important to avoid it if you have heart disease or high blood pressure, and it's not recommended for young kids.
And just like with everything else we've talked about, you have to know when it's time to get professional help. If your barotrauma symptoms just aren't getting better after a day, or if you see any bloody fluid coming from your ear, which could signal a ruptured eardrum, or if you experience severe vertigo, you need to call a doctor right away.
So there you have it. From infections to unwanted objects to intense pressure changes, our ears really do put up with a lot. But just by recognizing these warning signs and knowing the right steps to take, you can keep them safe. So the real question is, now that you know what to look for, how will you listen to what your ears are telling you?